So let's talk about everything that we plugged in. For D, that is actually our ordered dose. We get this number from the question, that is 150 milligrams, divided by H, and H is the dose on hand. What we are putting here is the information that we get from the problem or either the picture of a medication label. It is going to be how strong the medicine is that the pharmacy brought us. So the pharmacy brought us medication with a label that reads 50 milligrams in 5 milliliters. So it's 50 milligrams strong. So we plug 50 milligrams in where H is. We multiply it by 5 milliliters. Q stands for the quantity and dosage form. So for Q, we get that from the medication label that the pharmacy brought us. Again, we go back and we look at that label. It says 50 milligrams and 5 milliliters. It is that 5 milliliters that we put where the Q is, because we have to give 5 milliliters in order to get 50 milligrams of medicine. And once we put that information in, we get 15 milliliters. But that is not our answer. 15 milliliters is how much we would give in order to give 150 milligrams of the medicine. Going back to the problem asks us, how many milliliters will you give in one day? The doctor ordered 150 milligrams of medicine 3 times a day. So 15 milliliters is for 1 dose. The doctor ordered for the patient to receive 3 doses total in 1 day. So we take 15 milliliters and multiply that by 3, and our answer is 45 milliliters in 1 day.